Today we're going to talk about something that I've had a viral video for a long time and everybody wants to know more answers about it. So today we're going to talk about it. It is pain under your bra line, so your rib cage during pregnancy. What does it mean? What can it mean? When do you need to talk with your provider? We're going to go over all of that. And of course, when you're learning about the pains of pregnancy, you want to be sure to learn from an expert. Hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm also the creator of the online prenatal class for couples, The Easy Way to Get Prepared for Birth, which in fact is the sponsor of this video. Come join me in the online prenatal class for couples. It is an all-in-one birth class that you will find is surprisingly affordable. You will not see the $400 price tags over there, so come join me. Okay, pain in your ribs during pregnancy. What does it mean? Well, there's a few different things that it can mean. Now, most often it is caused due to baby moving up into what used to be your lung space, stretching your diaphragm, maybe kicking your ribs, and that is usually what causes this type of pain. And it can be very normal, and honestly, there isn't a whole lot we can do about it. You can talk with your provider about maybe physical therapy, but also using a heating pad and anything you can do to make it better if you can change your body mechanics, which physical therapy is great at doing if you're just miserable with the pain. It can also be ligament pain. So your uterus has all these things that tie it into the body. And a lot of times when you feel pain up here, it's because those ligaments are stretching, as you can imagine, as your belly stretches, and are just angry. Think of it as an elastic band that is really getting stretched. And I notice that these pains get worse kind of as your uterus is enlarging. So I'll even hear of it even in first trimester, and then again, like mid-pregnancy, and then later in pregnancy, people will have it. So if you're having pain at a time where your uterus is growing kind of a bit, then it could be ligament pain. That isn't to say that you shouldn't bring this to your provider. I do believe that if you are having pains, you need to let your provider know so that they can help distinguish if it's okay or not okay. You need to decide, is the pain normal? And you're good to know that from your provider, or is the pain affecting how you're living your day-to-day life? And that is something you need to address with your provider. Now, as a note, your provider is not great at muscles and bones, right? That's not their job. That is the job of an orthopedic surgeon, which we are not going to be dealing with during our pregnancy, or a physical therapist, or maybe even a chiropractor if your OB is open-minded. By the way, I love a good chiropractor. It's just that we see a lot of bad chiropractors online giving advice for things that they don't know anything about. So talk with your provider if these pains are affecting your day-to-day living and see who they recommend in your area to help you out. Okay, another thing that it could be is preeclampsia. Now, usually you're not going to see this until at least well into your third trimester. If you're having the pains at 20 weeks, most likely it is not preeclampsia. But again, bring it to your provider so that they know that you're having that pain. But with preeclampsia, your liver can enlarge. So your liver is on the right side of your body. And as preeclampsia happens, your liver can enlarge, which runs into your rib, and that can be really painful. So again, if you're having this later in pregnancy, definitely let your provider know so that they can do other tests. That isn't the only test that we have for preeclampsia. They're going to want to check your urine for protein, uric acid, ALT, AST. There's all these different things that help us know. They're also going to want to check your blood pressure, which I'm sure they do at every appointment anyway, but it can be a sign of preeclampsia. So if you're having liver pain especially with like headaches or blurry vision, you actually might need to go into labor and delivery right away because that could be a sign of advancing preeclampsia. Side note, if you are early in your pregnancy, your provider should be talking to you about taking aspirin because studies have shown that it can either decrease your chance of getting preeclampsia or decrease the severity of getting preeclampsia if you were to get it. So make sure that you're talking with your provider early in pregnancy because aspirin has been proven to really help with these things. Now, I actually had this rib pain with all of my pregnancies and I could not figure it out why. By the time I had my third pregnancy, I was older and I was pushing beds and I was just miserable. So my provider sent me to a physical therapist to check it out, as she should. Now, of course, this was a long time ago, 16 years, and physical therapists are not as good with pregnant women as they are today, thank goodness. But she ultimately decided that I had pregnancy-induced scoliosis. So as my baby would get bigger, a small scoliosis that I had would increase during pregnancy, which somehow made this pain right here absolutely miserable. So I actually ended up going out of work early just because pushing beds and the things that you have to do as a nurse were making it worse. So it may be something weird like that, but again, I brought it to my provider. She actually did an ultrasound for gallstones. She also did preeclampsia labs on me just to make sure that wasn't the problem, even though I didn't have increased blood pressure. Now, there are a few other incidental things that it could be. It could actually be constipation. So I always recommend that pregnant women increase the fiber in their diet. And if you're later in pregnancy, check out my post on eating dates during pregnancy because we know they have lots of fiber and can help with that issue. Weight gain can also increase your pain right here, and weight gain is inevitable during pregnancy. And so hopefully your provider's not saying that's the reason, but it could be a reason. If you're gassy, sometimes that can be a rib pain, or diastasis recti, which is where the muscles in your abdomen split. That can cause rib pain as well, just because of how things are adjusting and you're trying to manage your life as your abdominal muscles are separated. Again, that's something that would be great to see a physical therapist for. Oh, and one more thing I see a lot, coughing. So if you've had a recent illness where you've had lots of coughing, this can get really sore. It's miserable to cough while you're pregnant. And if you've been having coughing while you're pregnant, my heart goes out to you because it really is not fun. Fun fact, my rib pain after I had my baby actually just totally resolved. It was all due to that belly and how my back was trying to compensate for the change in my center of gravity. So that's good news. Most often this pain resolves after the baby is born. So when you go into your provider, say, I have this pain. If all you need to know is that it's normal, then you're good. Or say, is there anything I can be doing? Can I use a heating pad? Most often using heating pads that are not directly on the belly are okay. Maybe they're going to say an ice pack. Maybe they have something else that they recommend. But if it is affecting how you're living your life, please tell that to your provider. Say, it is affecting how I'm living day to day. There are tasks I cannot do in my family because of this pain. What else can I do for it? And hopefully then they will refer you to somebody else whose job it is to deal with muscles and bones, because that really isn't their job. Okay, have you had this pain? Tell me down in the comments. I would love to know. Did you find out what it ultimately was? I think that would be really interesting to start a discussion down there about that. And I have lots of other videos about staying healthy during your pregnancy that I hope you'll enjoy.